Hey guys, Dr. Childs here. Today we're going to be talking about a brand new thyroid medication called Tirosint Sol. Okay, this is a brand new thyroid medication, and we don't get thyroid medications very often, which is why this is actually kind of cool. So I'm going to explain to you what this medication is, how it differs from other medications like Tirosint and Synthroid and other T4 medications and so on, and talk also about whether or not you should use it, and then also some cons. We'll talk about that as well. If you don't know me, I'm Dr. Childs. I'm an internist, and I specialize in helping people treat thyroid problems, helping people with hormone imbalances, and of course, helping people lose weight. So let's talk about Tirosint today. I'm going to get out the whiteboard to do this, so I'll make sure that I read this to you because you're probably not going to be able to see all of this stuff, so don't get too concerned about that because I'll be saying it out loud. So Tirosint Sol is what we're going to be talking about today, and let's talk about just what this is briefly, just so you understand. It is a brand new thyroid medication, and it's actually FDA approved to treat thyroid conditions, so hypothyroidism or low thyroid function. So it can be used, and your doctor can prescribe it to you. The chances of your doctor knowing about this medication are incredibly slim, however, okay? So most doctors, they know only about levothyroxine, they know only about Synthroid, and maybe they've heard of some of the other natural desiccated thyroid medications like Armour and so on, but chances are very low that they're going to be recommending this to you. So that's why it's important for you to understand this. So what differentiates or what sets this medication apart? The main thing, probably the most important thing for you to understand, is that it has an incredibly small ingredient list. Okay, so it has only 3 different ingredients. The first one is the active ingredient. That means it's the active ingredient in all thyroid hormones and medications is the thyroid hormone. Okay, so that's what it is. So it's thyroxine, and thyroxine is T4. So this is a T4 only thyroid medication, which puts it in the same class as levothyroxine and Synthroid. And it has 2 additional inactive ingredients. So these are inactive. Inactive means that they're there really to stabilize the active component, to assist with absorption or to slow it down, or just to stabilize the compound so it can make it into your mouth and through the intestinal tract. That's what these inactive ingredients do. And the only 2 that it has are glycerin and water. So this is by far the cleanest thyroid medication that is available on the market. It's cleaner than the other natural forms of thyroid medication like Armour and NP thyroid and WP thyroid and so on. And it's cleaner than, of course, Synthroid and levothyroxine. And so what I've done here is I've compared these 2 together, and I'm going to tell you why this matters. So what I've done here is I've included the ingredient list of Synthroid as well, just to give you sort of a primer and something to compare it to. So Synthroid, of course, has thyroxine, right? That's the active thyroid ingredient. All thyroid hormones are going to have either thyroxine or triiodothyronine. You don't need to worry about that. That's T4 and T3. That's a fancy way of saying that. But then Synthroid has all of these other inactive ingredients. So it has acacia, it has confectioner's sugar, not sure why that's in there, povidone, talc, and then color additives. So why do these matter? These matter a lot because many of you taking these things actually react negatively to the inactive portion. Okay, and if there are fewer inactive portions like there are here, there's only 2 versus 1, 2, 3, 4, 5, and maybe 6 or 7, by the way. The color additives can be added depending on what color your Synthroid or levothyroxine is. Your body can negatively react to this, and it can delay absorption. It can impact how well your body is able to utilize it, and so it actually does a lot of bad things in your body, which in my opinion is why Synthroid and levothyroxine get such a bad name. It's part of the reason. There's other issues obviously too. Because it contains only T4 and so on. But one of the main reasons is that people simply don't react to it. And another example is that Synthroid and levothyroxine contain lactose monohydrate, which is, as the name implies, it's a lactose ingredient. So it's a milk-based ingredient. If you have lactose intolerant, you're going to react to it. Okay, so just another example of how these inactive ingredients impact how well your body can use thyroid medication. And so in this case, Tirosint Sol, by far the cleanest ingredient profile of any of the thyroid medications. So perhaps you already know about, so that's why this is important, Synthroid versus Tirosint. But what about Tirosint Sol? What about Tirosint versus Tirosint Sol? So if this is your first time being introduced to the Tirosint family, Tirosint Sol is the second iteration, or really just an extension of Tirosint. Now, Tirosint is the OG, or whatever you want to call it, the original. It's still relatively new. It's not as new as Tirosint Sol, but it is a gel cap, and it is more of like a capsule, more to like what you're probably used to experiencing when you would take Synthroid or levothyroxine. Whereas Tirosint is straight up a solution. It is a liquid formulation that comes in an ampule. So it's like you're taking a liquid. That's how you're getting your thyroid medication if you take Tirosint Sol. Now, Tirosint by itself, that's the gel capsule or the capsule, and it contains the ingredients. And once it's easy to break down. It's still really clean, but it is different. It has 1 extra inactive ingredient. So Tirosint Sol has 3 ingredients, and the regular Tirosint has a total of 4 ingredients. So just 1 extra versus the 6 here and so on. And I break down the ingredients of other thyroid medications and other posts. So I'd recommend if you're taking one that you know exactly what's in it, because then you'll have a better understanding of how it's impacting your body. Okay, so now that we understand the basics, who should use it? Is it a good idea for you to use it? We're actually going to talk about cons. I'm just writing it down here so that we can get to it at the end. But should you use it is a pretty important question. And I've listed out here, see, 1, 2, 3, 4, 5 different areas that, and I'll lift this up and I'll talk about it so you can see it here. But there are certain areas and groups of people that should consider using it. And I've put here, the first group of people that should consider it are those who have intestinal issues. So that includes issues like irritable bowel syndrome, inflammatory bowel syndrome, acid reflux, small intestinal bacterial overgrowth, small intestinal fungal overgrowth, chronic constipation, etc. Like low stomach acid. That's just off the top of my head. These are intestinal issues which seriously impact your body's ability to absorb thyroid medication once it is taken by mouth. Now, the good news is, because Tirosint is so clean and it has so few inactive ingredients, it's actually a lot easier to break down versus something like Synthroid, which has all these extra ingredients. So if you have any of these intestinal issues, number one, there's a good chance that whatever you're taking isn't getting completely in your system. So let's say you're taking 100 micrograms of levothyroxine or Synthroid, and if your intestines are out of whack because of the conditions I mentioned here, let's say you're only absorbing 75% of that. Okay, that's a big deal. You're losing 25% in your stool. And that 25% is not getting into your body to be utilized. So switching to something like Tirosint may increase that up to like 99% or 98%. And so all of a sudden you're getting a huge boost in the amount of thyroid hormone that is entering your body without really doing anything. You're taking the same dose, you're just altering what it comes with, and it's getting inside of your body, and in fact in a much higher dose. So I've seen a lot of people, when I switch them to Tirosint, this sort of thing happens and they feel better, you know, within a couple days, because I believe that this is probably what's happening. So that's one group of people. Another group of people who might consider using it would be those who have failed other thyroid medications. So if you're somebody who has taken other thyroid medications in the past, you've taken, let's say you've gone through Levoxyl and levothyroxine and Synthroid and Armour Thyroid, and you've done all these things and none of them have worked, and you failed, you know, one after another, it might be time to go to the Tirosint family. So either Tirosint or Tirosint Sol, which is the solution as we've been talking about. Another group of people would be those who are lactose intolerant. As I mentioned before, these medications contain lactose monohydrate. Tirosint and Tirosint Sol do not. And so if you have lactose intolerant, and by the way, sometimes this is, people are really sensitive to it. In fact, I remember when I was a resident and I was talking to a hematologist oncologist who was doing a study for certain drugs, and they were finding that certain individuals were reacting negatively to it. And he said, "Do you know why?" And I said, I just guessed. I said, "Did it have some ingredient in it?" And what the ingredient it had in it was lactose, and that was causing enough of a reaction in those people in small doses to cause stomach issues and gas and bloating and etc. So you really need to pay attention to it if you have lactose. Now, not everyone's that sensitive, but certain people are, and even drug companies know this, by the way. Another group of people would be those who have hypersensitivity to other thyroid medications. So if you've taken these thyroid medications and you have rashes, or you have even headaches or fevers or weird sort of reactions that are sort of like almost allergic or hypersensitivity in nature, then it might be a good idea for you to switch to something that's very clean, because the chances of you reacting to whatever, you know, red 22 or yellow 6 or blue 15, these are all color additives that are added to Synthroid. You can react to those things, and there are people who are just hypersensitive to those chemicals and ingredients that are included in these medicines. And then another group of people would be those who are taking antacids. So anything that blocks or lowers stomach acid, it's automatically going to be more difficult for you to absorb that thyroid medication. So consider that if you're on a proton pump inhibitor or an H2 blocker. The common names are like omeprazole or Protonix or any of those medications. I can't think of the other ones off the top of my head, but there's probably 10 plus of these medications that block stomach acid. And if you are taking any of them, it's going to be really difficult for you to absorb your thyroid medication. So what are the cons? I would say, you probably can't see this, but I've written con down there. So one of the main cons is really the price. Okay, so all new medications, when they come out like this, if they're brand name and there's no one to compete with, the prices are usually pretty high. So the price for this, is, last I looked, was somewhere between $140 and $150 per month. Now, that is a lot, especially when you can get levothyroxine for probably, you know, $4 to free to $4 per month. Synthroid's a little bit more, obviously. It depends because it's a brand name. But I would say if nothing else is working, and this is your only option, I still think it's worth it. And they do have some coupons that you can use. The manufacturers do. In fact, Tirosint has the same thing. So you can use these coupons to potentially get it for cheaper. So at least consider that. Now, I have no affiliation. I should have said this in the beginning. I have no affiliation with Tirosint Sol. Doesn't matter to me if they succeed as a pharmaceutical company or not. I'm only interested in giving you guys information to see if it works for you. But again, I don't benefit at all if you use this medication or not. I just want to make that clear. By the way, leave a comment below if you've ever used Tirosint or Tirosint Sol. So I want to know, especially Tirosint, because I think that one's a little more common. This Tirosint Sol is still relatively new. Like I said, most doctors don't even know about it. A fair amount do know about Tirosint, especially endocrinologists, and I have to give them credit. They will use it. But if you're using either of these, leave your comment and your experience below so you can share it with others. And if you haven't already, be sure to download my free thyroid PDF resources. You can download those off my website. I have tons of just free helpful information for you if you have any sort of thyroid problem. So I'd encourage you to take a look at those. And if you have any questions, leave them below. And otherwise, I'll see you guys in the next one.